Hi guys, Alex from Replokate. Just wanted to have a chat with you today about hot tips for things like pain relief. So you're having SMP treatment, or you're going to consider it, but you know that you have a very low pain threshold. We've got a suggestion that may well help get you through having SMP. So on a scale of 1 to 10, most people say that if they've had a tattoo, tattooing is kind of up at the sort of 9, 10 and even 11 mark. And for people that have had SMP, they say that the treatment can vary between sort of 3, 4 and 5. So obviously when you're spending sort of 1 or 3 or 5 hours in a chair, you do get a little bit of build-up of residual pain whilst having the treatment. But we do have comfort breaks through that, and we can, if it builds up too much in one area, then we can move across to another area and let that one cool down, and then likewise we sort of come backwards and forwards, sort of moving across the head areas. But if you do struggle with pain in general, then there are a couple of options you can take. You can consider taking a tramadol potentially, or a cocodamol as an oral tablet, or there's a very good product called Elmer Numbing Cream, which you can get from your local pharmacy. They come in 2 different sizes. The first size is a 5-gram box. This you can get over the counter at your local pharmacy because it's a small amount, it's about 5 grams. But to be fair, for the amount that you need to put onto your head, you actually are going to need probably a 30-gram box, and this you would potentially need to order at your pharmacist to then get it sort of delivered in for the following day. So, but this cream, I'm going to show you how to use this cream on yourself, and this is something you can do at home or prior coming into seeing us at the clinic. So there's going to be a couple of things that you would need. Obviously you would need to have your Elmer cream ordered and have it in the box. There are instructions in there which are very, very clear, but sometimes people are not 100% on how long shall I leave it on, and all of the sort of crucial bits of detail that you would need to actually get the maximum effect from the numbing element of it. So you're going to need a couple of things. You're going to need some micro pore tape, which you can get from your local pharmacist, and some good old house kitchen cling film. So you can get this pretty much anywhere. And what we'll do is we'll use this dummy head here, and I'm going to show you exactly how we go about administering the Elmer cream. Okay guys, so I'm going to show you now how we are going to administer correctly the Elmer numbing cream to your head. So you're going to need to do this about 2 hours prior to coming in for your treatment. That gives the maximum amount of time for the skin in the head to absorb the Elmer cream. So what you will need is you will need some scissors, you will need some micro pore tape as we said, and best thing to do is to cut yourself a piece of cling film that is going to fit the area where you have the hair loss on your head. So you want to do this in one giant sheet across the head. So let's say that you have hair loss at the front of the crown, hairline area and towards the crown, then you would need a sheet that would be big enough to cover that area. So you would basically just cut that to size and make that ready for you then to use. Okay. Also make sure that your micro pore tape is already also cut to length. So if you're doing it on your own, it can be a bit tricky if you've got all of these components all loose and everywhere. You want to have everything kind of prepped and ready to go. So you're going to be opening the Elmer cream box, and inside this would be the cream tube here, and then you would get a spatula. Now when administering the Elmer cream, you want to be putting this on very, very thick, almost like jam on toast. So what you will be doing is you will basically be dispensing the cream onto the spatula like this, and then you will basically be spreading it on at this sort of consistency. Now once you have covered the entire area where you have the hair loss, so that we're only looking at the areas where your hair has receded, you're going to be putting it on quite thick. Now once you've administered it all on over the whole head area, all the way through to the back, putting it on very, very thickly, You will then get the cling film that you've cut to size, and then you would place this over the area that you have put your numbing cream onto. Once you've put the cling film on, you are going to use then the micropore tape, and you are basically going to seal all the edges of the cling film in order to keep the numbing cream secure, and so it doesn't leak out basically from the cling film. So once you have gone round and you have placed the tape all around the edges of the cling film, you've got your Elmer cream underneath. That is basically, now you are ready to basically wait for about 2 hours and let that do its work. If the Elmer cream dries out on the scalp, then it hasn't worked. You basically want to keep the idea of this is it's going to keep it loose and soft, and the Elmer cream will work at its maximum effect. So you basically can then put in, as you've now done this, you're going to leave this for 2 hours. If your appointment is with us in the afternoon or if it's in the morning, you can then come to the clinic with us. With this all set in place, you can wear a hat or potentially a beanie or something like that, and when you come in, we can then remove all of these items, clean off the scalp, and then your head is nice and numb and ready for the SMP treatment.